It's all right. We told you, as always, we'll be chatting with San Juan Basin Public Health, 8 o'clock on a Thursday, unless some holidays get in the way or whatever. We don't have any of those coming up anytime soon, though. So, all right. So we've got Liane back on the line, San Juan Basin Public Health. How are things for you? Probably crazy as always, but maybe a little less crazy than some people today.
Well, yeah, there's a lot of interesting things going on, but in the world of COVID, we kind of decided over the holidays, Christmas and New Year's, that we were probably at halftime and that the second half would be every bit as busy and intense as the first half. And here we are. It is the beginning of the first half, and we have a lot of work to do and I mean all of public health has a lot of work to do to make sure everyone that wants a vaccine can get a vaccine.
Absolutely, yeah, and there are a lot of updates with that, I understand. Well, but I do want to ask first on that note is that a lot of different places are reporting that the vaccinations are not coming out quickly enough and that kind of thing. But to me, as a local standpoint, I think that it's going just as planned, isn't it?
It is, but I think the plans aren't as good as, and I don't mean our local plan, I mean like the statewide plan and the national plan just isn't as good as people would like. So we are. Well,
sure. We'd like everybody to just snap of fingers and it's done, but that's.
So would we?
Yeah.
And we don't have enough fingers to snap. That's what the problem is.
Right.
Yeah.
But the process is we're still on phase one, I'm guessing, with first responders right now, or.
Yeah, we're first responders are actually, okay, so it's super complicated.
Okay.
First responders are the top of 1B. And so I think first to kind of speak to, are we doing well locally? The 5 counties of southwest Colorado have been by far in the percentage of getting vaccine out in the lead for the state. We have done a phenomenal job. We're working as a region down here as 5 counties, and we are able to move all of the vaccine that we get, and we move it quickly. We're working at twice the pace of a lot of locations in the state, 50% faster than other locations, right? So we are well ahead on this. The problem is there just simply isn't, like you said, you can't snap your fingers and get everyone vaccinated at once, even though that's what we would all want. So there's this phased implementation plan, and the first phase in it was 1A, and these are healthcare workers that are treating COVID patients or coming into contact with COVID. And 1A is mostly done in our 5 counties. It's entirely possible that there's someone in that in that category who's been missed. So I don't want to say, we're done with 1A, nobody can go back. If you're a 1A person and you've been missed, absolutely reach out and we will find you where to get a vaccine. 1A also included people that are in long-term care, skilled nursing facilities, and the staff in those facilities. Now, this was a really interesting process because there was this federal program that was going to do all of these facilities and all the staff and all the residents. A lot of information wasn't available about this program, and there wasn't a schedule. So here in Southwest Colorado, most of our counties said, we're going to move into this population really, really quickly because we can't wait for this federal program if we've decided these are top priority. And thank God people did that because we all know the tragedies we've had there, and we don't want any more tragedy there. So now we're moving into 1B, and the state's plan for 1B is that's going to be a much larger healthcare effort. And in fact, according to the state's plan, local public health doesn't lead 1B. This is going to be hospitals, healthcare, pharmacy, primary care, safety net clinics. And they're really quickly working to get all of those types of facilities and providers enrolled in the program. At the same time, we're collecting information for people that are eligible for 1B, so then we can help people match up with where to go when those providers are enrolled.
Okay. As you were talking, it kind of occurred to me, and I wouldn't want to ask too much of specifics, but how are these being stored? Of course, the Pfizer ones that have to be at such a low temperature. I mean, is there just like an excess of ice cream freezers somewhere? I mean, how do we do that? And then does it have to be like a limited stock each time because we don't have the space for it to be cooled?
Well, it's not so much the space. getting it in limited runs also. So you're right. It does take a special freezer, and the state positioned around the state of Colorado somewhere between 10 and 15 of these special freezers. There may have been facilities that already had these types of freezers, and they do a weekly distribution of the Pfizer to these special freezers, and then there's a very complex set of logistics to move it from the hub to the facility that's going to vaccinate on the day that they're going to vaccinate. And there's lots of rules about how long you can have the freezer open, what kind of container it can be transported in, how do you use that container, how do you monitor the temperature during transport, and then when it gets to its location, because you don't put it in someone's arm in that super cold, below 60 degrees Celsius, right? There's a thawing and a reconstituting process. So yeah, this is all very complex. The good news is other vaccines don't have the same logistics as the Pfizer, and as more vaccines become available, there's going to be more, and including Pfizer. Pfizer is looking to kind of transition to this other type of storage, and this won't be so complex anymore.
Okay, I see. So just to clarify, are ours coming from out of the county then, and they have to be distributed quickly once they do arrive?
Our hub is in our county, but we're the hub for 5 counties.
Oh, wow. Okay. Understood.
Yeah.
All right.
And our staff is working then because we were chosen as the hub for 5 counties. Our staff has to monitor and work and order vaccine for all of those 5 counties, which is great. We're happy to do it. It's super complex, and it's the entire region that's been so successful so far.
Yeah, sounds like you guys, everyone there has got a nerve-wracking job, I feel like, but all right. So what about these vaccination clinics? I'm hearing rumors that there may be vaccination clinics that may be popping up at some point.
Yes, so there's a couple things happening. So first I want to say, my phone, let's hit decline. First I want to say that as well as we're doing, that's not good enough for people that really want their vaccine, right? And so
right.
The start of 1B is the first responders and the healthcare workers that were not identified as treating or exposed to, COVID on a regular basis. Then 1B starts to include everybody who's over 70 years old. And then it includes, other types of essential workers and healthcare workers that weren't included in 1A or the top of 1B. So we're not into that 1B group yet. And I've already forgotten your question because I got distracted because my phone rang. What was the part?
Vaccination clinics and what we're
right.
Yeah.
So it's a huge number of people as 1B expands, and the state of Colorado expanded 1B just before New Year's. So what's happening is we do have volunteers in the community who have approached us and said, we would like to do a large-scale vaccination clinic. And so we said, great, work through the plans, and we will, since we're ordering and distributing for 5 counties, that, if you can get that plan together, we will work with the state to get that plan resourced if possible. And then at the same time, the state is enrolling, these other providers, safety net clinics, primary care, pharmacies. They want the hospitals to continue in the role that they did for their workers. So these things are happening simultaneously, and then vaccine will start coming into all of these places. So potentially including a volunteer vaccine, community clinic. Absolutely. In people are interested. Great. We'll order vaccine, but we can't guarantee yet how much vaccine we get, every week in this region, or if we get any vaccine in this region. So it's this I think you just described it as a kind of nail-biting situation. It is. We're planning for everything because we want vaccine to be able to come into the region and go into people's arms as quickly as it's available.
Absolutely. Well, on that note, there may be people that don't know where they are in the line or how they're going to know when it's their turn. But I do understand that there are, and maybe that's where this comes in. There's alerts for vaccinations now.
We have a sign up on our website. It's the COVID-19 Vaccine Notification sign up. You can find it at sjbpublichealth.org. You click a link to a Google form, put in your information, and I think we're trying to be really clear that people want the information. We will push it out as soon as it becomes available to us. But if you fill out this form and you don't hear from us right away, it's because we don't have the answers yet, and we're really sorry. We want these answers too.
And one more time, where is that at?
sjbpublichealth.org.
All right. Would it be all right if we shared that on our social media pages?
Yeah, that'd be great.
Okay, I think we're going to try to do that a little later on today, just so we can get as many people signed up as possible. So on that note, I did want to talk a little bit about level orange. Last time we were chatting, we were planning on going to level orange and the upcoming Monday. That didn't happen. Obviously, it got delayed a little bit, but at this point, the countdown, I understand, has started a couple of days ago, where we just have to maintain under that specific number, which we are right now, right?
Well, we did move. The governor moved all of the counties that were in red restrictions to orange restrictions on January 4th. So we were moved by the state of Colorado to orange on Monday, January 4th. We don't have the metrics to meet level orange. So what that means is the 5-star businesses are also still operating at orange. They haven't been able to do looser restrictions from where they started.
All right, I see. So we technically, as a county, we are in orange at the moment.
Yeah.
Okay.
Yes. Yep. Yeah, and I'm sorry, that one was confusing. We were a little confused as well.
Yeah. I think a lot of people are a little confused. Everything just, with this world right now, everything just seems to change so quickly. But I assume we don't have any big numbers that changes anything of what we know around Christmas at this point.
We don't. The state this week has started to see an increase in cases. It's a little bit concerning because we, through the red restrictions, most places across the state went into effect in November. And then we started to see this real downward march. And part of the reason Colorado didn't have a Thanksgiving spike is because there were new restrictions put in a lot of places in November. So with that, seeing just the first week in January, an uptick is giving everyone some significant concern, but we don't know if it's trend yet or where we're going. So again, too early to tell, but really asking people, just because we got moved to orange and there's good news on the horizon, it's still wear your mask, keep your distance, limit your contacts with other households. We've kind of been talking about this a little bit. There is this statistic, we don't know if it's true, but there's this statistic that they tell you, which is, after a really long road trip, you drive across the country and you're most likely to get into a wreck, the last couple miles to your house. Let's not do that, right? We know good things are coming. Keep up the precautions right now.
Well, and you did have some potentially good news for me when I was asking off the air here a minute ago. But of course, you and I are both very much skeptics in anything that seems optimistic at times. But the new strain of the virus, they do believe that they did the contract tracing and have kind of stopped that in the state of Colorado that they know of at this point.
Well, I think stop that. Let's just say that Colorado has the ability to do more of the sequencing to look for the variant more than other states. That's why we found it in Colorado. So this is good. The state of Colorado, the state lab, has done more sequencing, and all of the contacts of the individual that was identified have all been traced down, and those samples have not come back positive. They've not come back with the variant. So there is really great news there, but I don't think that we can say we're out of the woods and we know the variant's not in Colorado. I think we're very pleasantly surprised and cautiously optimistic that this variant will not take hold quickly here. But again, it's up to us. We got to follow the precautions.
And the new strain itself, much like when COVID-19 in the first place came out, we don't know too much about it, right? I mean, all I've heard is that it's more contagious, but we don't really know much, right?
I think what is known about it is more contagious, and the suspicion is it's 40 to 70% more contagious than the variant that has other variants that have been circulating. But they're not saying that it's more damaging. You don't get a more severe course of illness. It doesn't increase your chances of having a fatality. But what it does, if it moves, 40 to 70% faster, left to its own without, protocols and precautions in place, it would infect and kill a lot of people, right? So that's the danger there. But we believe the vaccine, there's no reason to believe the vaccine as it's been developed will not be successful with this variant and other variants, right? That, viruses mutate. There will be changes. Over time, there may be changes to the vaccine to keep up. But right now, that's not something that's in the plans, nor has it been determined to be needed in the plans.
You've never talked to her, but my co-host has said that from what she understands, influenza, and I'm not comparing the two, please don't think I am, but the vaccine for that only helps with a few strains of the tons of strains that there are. Is that correct?
Yep, that's absolutely true. And every year there's work done to match the flu shot. What you call the flu shot, right, is every year it's different because there's work done to match it to the strains that are circulating at that time. And there's always movement in that, right? But, that's why you get a flu shot every year, or you should get a flu shot every year. And quite frankly, some years they're more effective for the strains that are circulating than other years. And, that's why there are cases with a flu shot where you can also still get the flu. That's not the case with what's going on with the coronavirus and the corona vaccine.
Well, and I don't know nearly enough about those kinds of things. I understand that a coronavirus is different than what the flu. Like there are different categories there, but right. What is it that ensures us that eventually, with the mutations, even with a vaccine, the virus is still likely to exist. So, what is there that ensures us that the next mutation or the one after that or something will continue to be able to be covered by this vaccination rather than follow the line of other things like influenza?
Well, I think over time, the other things could happen. But for right now, there's a ton of work being done to sequence and learn about the variants that are out there. And those variants right now are covered by this vaccine. And we expect that to be the case for some time. Could it end up like the flu in the future? Where you're getting a shot every year, like when you go in for your flu shot, you get a corona shot too. I think anything's possible, but that's not where we are right now with this vaccine.
I'm glad to hear it.
Yeah, we're really relieved to hear this. Yep.
Well, and I did reporting from the I read reporting from the Durango Herald that says there's security increases at COVID-19 testing locations. What is that all about?
Pandemic has become, it's really politicized, and I think having to follow protocols to stop spread of infection and keep hospitals from being overwhelmed, right? Because if the infection spread at the pace it would spread without us following protocols, we would overwhelm healthcare. People would not be able to be treated, and the fatality rate would be so much higher than it is, right? So what we've done as communities and as a society is agreed to put in some protocols, keep the spread of infection at a lower rate so that when people do get it, hospital care is available if they need it, and they have more successful outcomes. This has led to this very, very difficult political culture. And there are some people that are protesting at test sites. This is not just happening, that's not happening here, but we've heard that this is happening around the country. It's happened, we were asked to be on alert by the state for this type of thing. So we have, spoken with the test site and just said, let's all just please be aware of this, because if someone has symptoms, we really need them to come in and get a test. And we really need people to be able to do that safely, with privacy. And we owe that to the workers that are out there doing really important work. And these are also going to be, how we get communities vaccinated if we do these large-scale efforts. So we've got to just come together as a community and say, let's do the right thing. And in this case, if it, means increasing security so that the right thing can happen, that's the way it's got to be. It's not great.
Understandable. Yeah. All right. Well, Liane, is there anything else that you'd like to throw out there today?
No, just thanks for having us. We're, welcome to 2021, and let's all, keep following the precautions, find out when you can get a vaccine, get yourself vaccinated when it's available to you, and we will get through this. So let's all do it.
All right. Well, I'm going to close it up with saying, everybody, please go and sign up on the website to get the vaccine. We'll have it up on our social media, hopefully a little later today too, so you can find it there. SJBPublichealth.org.
Yeah.
Okay. Go and sign up so you can get an alert, and we can keep the process moving here.
All right.
And Liane, thank you, and tell everyone over there at San Juan Basin Public Health, thank you for us as well.
Thank you.